Hi, this is the Polito family from Grandview.
And this is Vincent's Pediatric Health Source story. The pregnancy was not normal. I had a lot of complications. I ended up on bed rest. When we had the baby in the hospital, one of the nurses thought she heard a heart murmur the day he was born. Most likely it was a tiny hole in the heart. And when we actually had the echo done on his heart, we found out it was a much more serious condition that needed major surgery. But I was scared. We just got this baby and maybe soon we wouldn't have him anymore.
She texted me, she said something's really wrong. She said, well, Vincent has a heart condition and he's going to need surgery. So at that point, I told everybody I need to go over to Children's and be with my wife and be with my boy. Dr. Faruqi was very, he was very calm in explaining everything to us, that, he has a congenital heart disease and he will eventually need surgery. We kind of just have to watch him and can't let him cry, which was really hard to do.
Huge stress, huge stress. That's how a mother tells when the baby needs something. They need their diaper changed, they're hungry, they need to burp, whatever, they cry. And I couldn't let him do that. I was up early one morning feeding him. I turned on the news and I saw Tacoa's Pediatric Health Source story, and seeing that another family had to go through something and they were okay, and seeing their interaction with Dr. Galantowitz, and I know that's going to be my doctor, and I saw how calm he was and how attentive he was to them. It really made me feel a lot better. Everyone we met, from pre-admissions to when we actually met Dr. Galantowitz, was nice. It was almost as if they knew we were scared. They didn't point it out, but they let us know that they were there if we needed anything, let them know.
Dr. Galantowitz actually came in and saw us right before they took him back, and he said everything's going to go well. He
was attentive to Vincent. He never once called him the baby or the patient. He called him by his name. He was very reassuring. He told us everything's going to be okay. At one point he took my hand and he said, I know that you would rather be having the surgery, that it's hard to give your baby to someone else and have this done to them, but I'm telling you, he's going to be okay.
It was kind of hard to know that he's going to be put to sleep and there's a chance that, he might not wake up.
You think I could be giving him away and not getting him back. I knew that things had gone okay because we got the call. He just had to go off the heart-lung machine, and Dr. Galantowitz was wonderful.
He was very, very calm and very confident, and I think that makes a lot of difference whenever a doctor comes in and talks to the family.
He came in, he spoke to my family, he explained that he did find something extra, but not to worry, it was also fixed, that Vincent did well. I wanted to hug him, it's like he's our family's hero. He saved our child, and he does it every day, and so do, all the other surgeons and doctors. It's amazing, just he's playing with my fingers, and he's warm and cozy and cuddly, and he's happy and he's smiling and
or crying
or not. For the most part, it's like we got a do-over. Here's our baby, and we can let him cry now. Yeah.